Have you been prescribed an oral antibiotic like doxycycline for your dry eye, only to find that it wrecked your stomach, caused sunburns, or simply stopped working after you finished the course? You're not alone. Today, we are discussing why we use these potent medications and exactly what to do when your body may not be able to tolerate it. Welcome to Dry Eye Explained. I'm Dr. Wilson, OD and expert in dry eye and ocular surface disease. If you're struggling with discomfort or looking for real solutions, you're in the right place. For everything dry eye related, be sure to visit our website, dryeyeexplained.blog. And if you're ready to take complete control of your eye health, check out our eBook, a comprehensive, step-by-step guide to understanding, managing, and treating dry eye. Today, we are breaking down the world of oral antibiotics for dry eye disease, specifically doxycycline and its highly effective, often better tolerated alternative, Minocycline. Let's get started. When most people hear the word antibiotic, they immediately think of an acute infection like strep throat or a sinus infection. But in the world of dry eye management, we do not typically prescribe medications like doxycycline or minocycline to stop an eye infection. We prescribe them for their effective secondary superpower. They are potent, deeply penetrating anti-inflammatory agents. To understand why this is necessary, let's first talk about the anatomy of your eyelids, specifically your Meibomian glands. These are the dozens of tiny vertical oil-producing glands lining your upper and lower lid margins. Every single time you blink, they are supposed to squeeze out a clear, thin layer of oil that coats your aqueous tears and prevents them from evaporating into the air. But in conditions like Meibomian Gland Dysfunction, MGD, and Ocular Rosacea, these vital glands become chronically inflamed. Instead of secreting a clear, smooth substance that looks like olive oil, they produce a thick, stagnant, cloudy paste. This is where oral antibiotics from the tetracycline family intervene, specifically doxycycline and minocycline. They work by actively inhibiting specific inflammatory enzymes called matrix metalloproteinases, or MMPs, that cause cellular damage on the surface of your eye. They also inhibit bacterial lipases. We all have normal, healthy flora living on our eyelid margins, but sometimes these local bacteria produce enzymes that aggressively break down our healthy tear oils into irritating, soapy byproducts. This is called saponification. By halting this biochemical process, these oral medications help turn that thick toothpaste back into a healthy, flowing oil, addressing the root, evaporative cause of your dry eye. So, how do you know if you are a good candidate for this treatment? Typically, patients who require oral antibiotics have progressed significantly beyond mild, occasional dryness. You might be experiencing a persistent burning sensation, or your eyes look chronically red and bloodshot no matter how many artificial tears you use. You might also be someone who suffers from recurrent styes or chalasia, those painful swollen bumps on the eyelids. A recurring stye is a hallmark clinical sign of deeply congested and inflamed oil glands. We also frequently prescribe this for patients with systemic or ocular rosacea. If you have facial redness, broken blood vessels on your cheeks or nose, or skin that flushes easily when exposed to triggers such as spicy foods, alcohol, or hot weather, there is a very high probability your eyelids share that exact same underlying inflammatory. It sounds great on paper, however. Traditional doxycycline has its own set of triggers and side effects that cause many patients to abandon the treatment. For a large percentage of patients, doxycycline can cause gastrointestinal issues, including nausea, acid reflux, or an intensely upset stomach. It also induces photosensitivity, making your skin sensitive to sunlight, leading to painful sunburns if you aren't routinely applying sunscreen. And for some patients, after a few months of use, doxycycline simply plateaus and loses its effectiveness, leaving you right back where you started with burning, painful eyes. If doxycycline isn't working for you, or if your gut simply cannot tolerate it, do not lose hope and do not give up on your treatment plan. We have an incredibly effective alternative within the exact same antibiotic family, minocycline, Minocycline is highly lipophilic, which is a clinical term meaning it penetrates fat and lipid-rich tissues, such as your meibomian glands, exceptionally well. Because of this high lipid solubility, many clinical studies and practitioners find that minocycline can actually be more targeted and effective for severe MGD than doxycycline. Let's carefully weigh the pros and cons of switching. The single biggest advantage of minocycline is that it is generally much gentler on the gastrointestinal tract. If doxycycline gave you terrible acid reflux or nausea, switching to minocycline often mostly resolves those gut issues while maintaining the anti-inflammatory benefits for your tear film. Furthermore, minocycline is also significantly less likely to cause photosensitivity compared to doxycycline, making it a much safer option during the summer months or for those who spend time outdoors. However, minocycline is not without its own distinct risks that you must be aware of. While relatively uncommon, it can cross the blood-brain barrier slightly more easily, which means it can sometimes cause transient dizziness, lightheadedness, or vertigo, especially during the first few weeks you start taking it. In very rare cases with long-term high-dose use, it can cause a harmless but visually noticeable bluish-gray or brown pigmentation of the skin, teeth, gums, or even the sclera, the white part of the eyes. When prescribing either of these medications for dry eye, the clinical strategy is always low dose, long duration. It isn't used for short-term infection. We are carefully down-regulating chronic inflammation. Typical dosages might be just 50 milligrams a day for a course period of 2 to 3 months. To maximize the effectiveness of these medications and strictly minimize your risks, here is my evidence-based, actionable advice if you are beginning this therapy. 1. Protect your stomach lining. Always take these medications with a full 8-ounce glass of water and right in the middle of a substantial meal. 2. Timing matters. Never take them within 2 hours of lying down to sleep, as the capsule can sit in the esophagus and cause heartburn or ulceration. 3. Watch out for calcium. Avoid taking them simultaneously with dairy products, calcium supplements, or antacids. Calcium actively binds to the tetracycline molecule in your stomach and completely stops your body from absorbing the medication. Space dairy out by at least 2 hours. 4. Support your gut. Since you may be on these medications for several months, strongly consider taking a high-quality probiotic to protect your gut microbiome and prevent the bloating that can accompany long-term use. 5. Combine therapies. Remember that oral medications work best in conjunction with in-office medical treatments like IPL, low-level light therapy, or LipiFlow. The in-office treatments physically clear out the stagnant blockages, while the oral medication reduces the inflammation from the inside out. To summarize, navigating dry eye is a complex journey, but whether the answer for you is doxycycline or minocycline, profound and lasting relief is absolutely possible. Always consult your local eye care professional before starting, changing, or stopping any prescription medication. If this was helpful, keep your eyes on our channel. Please hit like, subscribe for more evidence-based tips, and leave your questions about this topic in the comments below. Visit our website for more information, and while you're there, consider grabbing a copy of our eBook, your complete comprehensive guide to understanding, managing, and treating dry eye. Thank you for watching, stay comfortable, keep prioritizing your eye health, and I will see you in the next video.